In honor of World Mental Health Day, I wish to celebrate all of those who are finding their voice, individuals reaching out for help, and those who are breaking their silence. Your courage and your strength are truly worth celebrating and recognizing. Today, I am joined by Prime Minister of Canada, Justin Trudeau, who is dedicated to creating a safer world where the mental well-being of Canadians is supported. Thank you so much for engaging in this conversation with me. I hope we can inspire and bring awareness today.
Well, listen, Brittany, you've been doing amazing work inspiring so many, and I'm just privileged to be able to sit down and have a conversation with you about this.
Thank you. Mental health has been a growing problem, especially in recent years. What is your perspective on the importance of taking care of your mental health?
Mental health has long been a problem in society, but it's only more recently that we've actually started to grapple with it in any serious way, which hasn't come a second too soon because, as we all know, the pandemic made everything so much harder for everyone. But the advances made in destigmatizing mental health, the fact that so many more people are comfortable putting up their hand and saying, I'm not okay, I need a little bit of help, where can we go? I'm, not the idea that, you gotta just toughen up and power through. It's like, no, it's, you wouldn't tell me to do that if I had diabetes or if I had a broken leg, just power. No, you go get help, you get that support. Understanding that mental health is health is something that a lot more people are doing. One of the challenges we're facing, though, is that our entire system around mental health, the ecosystem around it, was built up for a time where only a very small fraction of people would actually put up their hands and dare come forward and ask for help or would be driven towards help. And now that everyone's putting up their hands saying, I need more help, we need so many more resources. And that's something that we're all working on together.
And one thing you said there was before fewer people raise their hands and speak up, and the next question really relates to me because I was that person. I didn't want to raise my hand and speak up, and I remember, as a child, it was really hard growing up because I had a really rare anxiety condition called selective mutism, which basically meant I didn't speak for 7 years. And at the time, when I was little, my parents didn't know anything about mental health, there wasn't awareness at the time. And then I outgrew that mutism, and then high school came along, and you can tell on the outside I looked happy and I had friends, but on the inside I was struggling, and I was, dealing with suicidal thoughts and depression and anxiety, and it came to a point where I started to think about my life and I wasn't happy. And, at that time, that darkest time in my life where I was thinking, my life, I'm not good enough, I don't want to live anymore, thank God I had this inner voice that told me you need to live and you need to change your life around. And because of that inner voice, I reached out for help at 15 years old, and I got the help. And that inspired me to write my book when I was 16, which was a best-selling book to help other teens who are, struggling with their mental health struggles. And because I, reached out for help, I'm here today and I'm happy and I'm helping people. But luckily I had parents who really supported my mental health journey and who allowed me to go to therapy and helped me, and that was really helpful. But for young Canadians who don't have support, what resources are available for these Canadians dealing with mental health struggles?
Well, first of all, your story, that fact that you were struggling and had the strength to actually reach out and to ask for help, that is at the center of the success of any mental health advocate, of anyone who's able to inspire, encourage people to say, first of all, when you're struggling with mental health, I know I've heard it from so many people, you feel so alone. You feel so ashamed or like nobody's going to be able to help you or anything. And that first step of saying, I think I'm not okay and I need support is a huge step. And then that you had a supportive environment is massive. But you're right, not everyone does have that. And that's where resources, particularly through the pandemic, we really realized we needed to invest more in resources. We put $15 million towards Kids Help Phone, which is a really amazing resource that has grown and grown and grown. We're moving forward with 988, which is a suicide hotline that'll be active, I think, as of the end of November this year. So it's another tool. But every workplace, every order of government, everyone has their role to play in creating an environment in which there are resources, in which there is an ability to have honest conversations and open conversations about these things. Mental health delivery, as you know, is a provincial responsibility, like healthcare delivery across the country. But there's still lots of things the federal government can and is doing to make sure we're supporting the funding of mental health services across the country, making sure that everyone's achieving a similar level of outcomes in health, and there's a lot more work to do.
And that is really important that you're, supporting mental health. And as a child, I need a leader like you who is supporting mental health, and that is really important. So thank you for that. Next question I have is, I know so many people still feel as if there's a stigma for mental health in the workplace. How can workplaces create safer and more accessible environments for those struggling with mental health?
Well, first of all, even before you get to workplaces, understanding that everyone knows someone who's struggled with mental health. If it's not you, it's your brother or your mom or your best friend or a coworker. It is so everywhere that we really need to understand and get past those stigmas. But I know that growing up, I was in my early 20s when my mom, we were looking at some old pictures and she pointed out, and I said, "Oh, Mom, you were really skinny then." She's like, "Oh yeah, I was really, really facing a lot of depression then." Yeah. And that was the first time she'd ever said anything about her mental health. I remember being, "Oh, you were depressed." And of course, later and her struggles with bipolar were definitional for her and for us. And I got to see her both struggle and overcome tremendous things. And now she does an amazing job inspiring and supporting people. Similar, my former partner and best friend, Sophie, she went through some really, really difficult times with bulimia, eating disorders as a teenager, and it was when she talked to her mom and said, "Mom, I'm not okay," and they started getting support, and now she's been an amazing advocate for mental health supports. And it's just seeing all these people around me who are inspiring and open about struggles and showing tremendous strength in coming to it, I think is something we all have to appreciate. And in our workplaces, making sure that people know what resources are there, people understand they can talk about these sorts of things, and then making sure that we're putting the emphasis on taking care of ourselves and in our workplaces and our teams. I mean, in politics, it's crazy, the pace of stress, of anxiety, of hard work, of long hours, of intensity. But that means it all more important, whereas before we'd, generations past, you'd say, "Well, tough it up, just power through, it's a really important thing." People's like, "Okay, no, you need to take a day, we need to figure out how to better support you." And I think workplaces are changing, but not all of them, and we still have to push.
Yeah, and that is really important, like you said, is knowing that people are not okay. Yeah. And that's the first step, is getting them the right help. Thank you for sharing that. Stigma surrounding mental health remains a significant barrier to seeking help. I know when I was young, reaching out for help was a scary thing because you feel like, if you reach out, people will judge you, or you're weak, or something's wrong with you. But how do you believe we can collectively work towards reducing the stigma and creating a more open and supported society for those facing the mental health challenges?
Well, there is this perception that, the only way to be strong is to not ask for help or to not need help. And what we're beginning to see, and it's a very real shift that I'm seeing actually being led by young people in a lot of ways, to say, no. Strength is being strong enough to ask for help. And to say, yeah, you know what, I'm not okay right now, and I need some extra support. I need you to, be there for me. I need this, I need that. That is, taking ownership of yourself, taking control of your life in a way that's really, really inspiring. I have to say, when I started in politics, I spent a lot of time with young people, and I consider myself being fairly open around mental health challenges all my life, but even I was blown away by how bold and fearless so many young people were. When I had a public town hall, the first person to put up their hand to say, mental health question or anything, would be a young person saying, "Look, how do we help each other? How do we help our kids? How do we help me through these things with mental health? And it was just really inspiring.
Young people are speaking up, and that is so important for young people to do that, to continue
Really
doing
is.
that. How does your government ensure accessibility and affordability for mental health services and support? Is there some initiatives or policies that are aimed at improving mental health services for all citizens?
Well, I mentioned we invested a lot in Kids Help Phone, particularly through the pandemic, where so many kids are feeling isolated and just needed those resources. We also built a Wellness Together portal, and that was helpful during the pandemic. But more than that, we need to make sure that we're increasing mental health services across the country, but also mental health resilience. We're in the middle of renegotiating. When we first got elected, we signed some health deals and put $5 billion towards mental health across the country in the provincial systems, and that was a good thing. But now we've renegotiated them towards the next 10 years, and we're talking about close to $200 billion for a range of priorities, but one of the 3 or 4 priorities we're talking about is mental health, because every jurisdiction, everywhere across the country understands how important it is to have better resources on mental health. We are also working with the Canadian Institute of Health Research to establish national standards around access to mental health services, to make sure that we can compare, whether it's a small town or a big city in one part of the country or another, to make sure that everyone is having access to this. The federal government is only sort of indirectly involved in lots of ways, but we can do a lot around talking about it. We have a Minister of Mental Health and Addictions for the first time in Canadian history, and being forward-leaning about the resources out there and how important it is to be investing in them, whether it's a workplace, whether it's a family, or whether it's an entire country. That matters.
Which is really important, that mental health matters, and that's amazing that your government is doing that to help all these individuals struggling. So people like me, who was, very struggling a lot, can find a voice and reach out for help and get help. That's important.
You're an inspiration. I mean, what you have done. I mean, having challenges with selective mutism, and now being so powerful in your voice as you are now, is going to be such a huge inspiration to everyone. It's a great thing.
I appreciate that. It is crazy sometimes when I didn't speak, and now I'm speaking to crowds or people, or even to you.
That's the best thing.
Things can change for sure. This question is also very personal for me, because I've grown up in social media. I've seen the negative effects of it. I've seen it transform, and even before I published my book, I've been bullied. I've seen cyberbullying, all that, and now having a platform, there's a lot of negativity, a lot of mean things that do affect your mental health. It affects me when I see the mean things being put on social media. How do you think that private tech companies can better protect our society? How can these companies protect people from hatred and cyberbullying and negativity? It's a hard one.
It's a huge conversation that we're busy having right now. Because, I mean, even to step back from tech companies, the space, I have 2 teenagers, and the space that social media takes up in their world and their friends' world and where they live is so huge. And we all know that what starts online ends up having an impact in the real world. There's a false distinction between, that's just online, it's not real. No, particularly for this generation, yes, it is all real. And we have companies that developed with the goal of signing up subscribers, selling ad revenue, getting more clicks as the goal, that suddenly have a huge impact and therefore a huge responsibility over the well-being of entire communities. And conversely, governments, whether it's a local government, a provincial or a federal government, have less ability to keep people safe in the public square. I mean, if you're walking down the street, we can keep you safe. If you're in a virtual conversation, we don't have the tools, and we probably shouldn't have the tools to directly help it. So there is, there's certain things we can do, and we're very active in the Christchurch call to end online violence, and we put forward a digital charter, and we're trying to work with various social media and digital companies to become more responsible. But this idea that that there is a responsibility by these platforms over the society that they have such a huge impact in is a step that some companies are starting to understand, but a lot of others are just, no, we're just putting technology out there. You know, how people use it is up to them, when they have really sophisticated algorithms that go forth. And even, you know, stepping back from any of those specific companies, you think about how much care an individual, particularly of a younger generation, puts into finding just the right angle for the picture, just the right snapshot of their life, you know, that is carefully curated to be just the right image. Yeah. And you know yourself that that's you at your very best with just the right lighting and just the right thing, and it doesn't show the messy pile of laundry next door, like next to you or whatever. But then you know you're going to be judged and liked or not liked or bullied or you know, flattered based on that, and it has a direct impact on how you feel about yourself when you know perfectly well that that's not even you. Yeah. So you're being judged on something that is a version of you that you've carefully created and is not the real you, and yet if it's judged negatively, it has a huge impact. If it's judged positively, it has a huge impact. And people are getting more and more detached from their own realities and their own personality. And that's where there are great conversations and resources and starting to be a swinging back of the pendulum where people are really digging into the realer side of conversations and support and great resources online. So we talk a lot about all of the negativity, but I mean, you're an example of a source of positive inspiration and real conversations that I think is going to become more and more important, and that people are themselves going to start choosing more of.
Yeah, I think that's really important what you said, and that's why I love the purpose of putting my positive messages on social media and using it as a positive, because there are so many negative, and if I can inspire at least one person a day, then I know that I'm doing something right. And one thing you said there that is so true is people literally won't show the dirty laundry, they don't show the bad side, and I think that's the thing is be authentic. Nothing is perfect every day. There's literally days where it's not good, and I think that is the beautiful thing is when you do speak up and you do share your bad days.
Or your vulnerability.
Yeah, or your dirty laundry.
But when you do that, and that's more genuinely you are opening yourself up to so much more hurt and criticism when you do that. So it's balancing how to do it and how to be strong enough to do that. It inspires me in every young person I meet that you're already managing to try and balance what is real, what is good, what is not. And I mean, that is a huge toll and tax on your mental health. But it also, through those experiences is building up a level of resilience, I think, that I'm really optimistic about this generation into the future.
That's really insightful. How can you encourage people to seek help or partake in therapy when faced with mental health challenges? What steps should individuals take who may be hesitant or unsure about reaching out for help and support?
Listen, first of all, like I said, if you have a medical problem, you're gonna, if you have a bad elbow, you'll talk to a doctor and ask for advice. And it's you didn't know how to deal with your, injured elbow? I guess, no, I'm not a doctor. This is why I turned to you. Well, why should we feel any different when you're feeling overwhelmed with anxiety? You are an expert on yourself because you've been yourself all your life, but you're not necessarily an expert on how your brain works or where your emotions are going. And there are lots of great resources out there. And, you can start small and you reach out to something like Kids Help Phone anonymously and just, talk some things through. But there are so many great resources, whether it's at school or university or in the workplace. And what we all need to do is do a better job of showing and highlighting those resources out there. I was talking to a friend of mine, a senator named Stan Kutcher, who's done a lot of work on mental health and resilience. And he was saying that he'd look at places where there had been civil wars or terrible atrocities or challenges, and he'd look at what the resilience is in the population. And one of the things he said is, yes, you all need every population needs mental health workers and psychiatrists and psychologists and experts and doctors, everything. But if you train up more people in mental health first aid, right? So hair salon folks and bank tellers and police officers and crossing guards and just, every random person walking down the street might know a little bit about how to spot someone in distress and support them through it and say, okay, here, just sit down and breathe and let's talk about it, or how can we give you space, or know how to intervene and get someone the support they need in a moment of mental health acute crisis. That's already steps in the right direction. And if, as a friend or as a colleague or coworker, or you can actually know to ask, so how you doing? No, don't say fine. How you doing really? What do you need? Do you need to go for a walk? Do you need to chill? Do you want to get distracted? Do you need to just sleep? What are you needing, and how can we be helpful to each other in our own mental well-being? This is what we need to learn, and not to just say, oh, I'm fine, don't worry about me.
Yeah.
No, worry about me. Let's lean in and let's support each other.
Yeah, that is really true. How can I help you?
Yeah.
What
Because
can you do? Yeah.
one of the secrets on helping someone is when you can actually, support someone around, they get better, but you get better as well. It is so incredibly validating for a human to feel like they've had a positive impact on another human that we don't often ask enough. How can we help each other?
And that's really important to everyone, parents, anyone. How can I help you? And this goes to the next question. I know as a parent, it can be really hard when your kid is going through struggles. And I know my parents felt really helpless and said it was one of their worst days when they saw me struggling because they didn't know what to do and they didn't know how they can help. So as you're a father, what advice would you tell your children if they were showing any signs of struggle?
First of all, creating as a parent an environment in which you can talk about just about anything and be comfortable and close, and try and meet them where they are, and not expect and not bring your own expectations or frustrations to a situation. I mean, it's easy to say, so much harder to do. I mean, I'm lucky in that Sophie is amazingly thoughtful and attuned to sort of mental health challenges. She's done a lot of reading expertise on it, but it's always different when it's your own kids, and learning how to be patient and meet them. And if a conversation goes off the rails, learn to breathe, step back, say, okay, can we start again? And don't feel as a parent or a boss or anyone that you're supposed to have all the answers either, because whatever you do, you're not necessarily the expert in what is actually needed, but you can help find that expertise. You can get that help, and that ability to support people in support your loved ones in getting the right help, getting the resources. That's what being a good parent is all about, or a good friend, or a good whatever.
Yeah, good anyone. And this you kind of answered the question, but what steps would you take if parents don't know what to do with their children or don't know how to help them?
There's lots of resources. Start with the closest resources, whether it's the kid's school, find out what supports there are there. Go online. There's lots of great resources. Call Kids Help Phone and ask what their advice is. I mean, there's lots of different resources out there. You can't go, be careful what websites you go on for advice, but if you're thoughtful about looking for resources the government has certain resources. I know every province has a really robust healthcare portals that can direct you in the right direction. Don't feel like you should know everything, and don't feel like just because you're a parent and expert in your kid that you can solve whatever the challenge is. That's why we reach out to a community of experts.
And that's important, is reaching out for help. Besides being a leader of a country and as a person, as an individual, do you have a personal experience or connection to mental health that drives your commitment to improving mental health services and awareness?
Well, my mom has been a huge inspiration all my life. Her struggle with bipolarity showed me that how vulnerability and struggle can actually be incredibly, as a source of strength, incredibly inspiring. And that, for me, my dad was always so tough and strong and old school in all those ways. And that sort of shaped my image of what true strength was when I was a little kid. But then I saw how my mom overcame so many challenges and struggles, and I realized that true strength comes in all sorts of different forms, and making sure that we're honest and open about the struggles that we're facing and how we support each other. I often joke that I wouldn't be my mom's son if I wasn't therefore then pushing hard on mental wellness with all the tools that I have in this role.
Yeah, that's amazing. Having that experience always helps you and motivates you to do more, right? Looking towards the future, what are your government's long-term goals and steps for improving mental health services and support in Canada?
Well, I think seeing a time where there is not this arbitrary distinction between mental health and all other health. I mean, understanding that physical health is hugely impactful upon your mental health. If you're eating well, if you're sleeping well, if you're exercising regularly, if you're working hard at something that matters to you, but you're also playing hard with your friends, these are all physical things that are going to contribute to your mental well-being in a very meaningful way. And similarly, mental health or mental health challenges will have a direct impact on the physical side as well. So I think as we move forward, preventing this sort of arbitrary distinction between, we'll see you right away for a heart attack, but if you're going through an anxiety phase, well, we can maybe see you in 6 months or something like that. It's like, no, I need help right now. Like getting people to be more responsive with the appropriate supports in the appropriate ways. Not everyone going through any crisis is automatically going to need, you need to go to a psychiatrist or you need to go to an institution, but getting the right kinds of supports and getting those better paths, I think, is a huge part of where we need to go as a society.
I agree with you. And before we end this, for any Canadians listening to this right now who might be struggling, what words of encouragement can you say to these people?
Well, even before I'm encouraging, first thing I'll say is, it's okay to not be okay.
Powerful.
We all go through really, really difficult times in our lives. I seem to have succeeded well in life in some ways, but my God, I went through my own struggles as well. When my little brother and then my dad died in short succession, I needed to lean on help with therapy. I talk about it in my book years ago. There's always time to learn and grow and lean on each other. And the measure of how strong someone is not how much they can do alone without needing any help. It's how good they are at drawing on that help and building themselves up to be even better with it. So don't for a second ever think that reaching out for any help is a sign of weakness. On the contrary, it's a sign of strength.
That is so beautiful. It is a strength. And I just want to add one thing is that, for anyone listening to this, I know how alone they feel. I know what it's like to struggle. I know what it's like to, not feel good enough and not want to wake up the next day. But I also know what it's like to wake up and change your life around. And because of reaching out, because I did that, I'm here today. I'm sitting with the Prime Minister of Canada, Justin Trudeau, and there's so much more on the other side when you do get help, because your life really can change for the better. And I really do hope that anyone listening to this who are feeling alone or feeling like their life doesn't matter, I hope that they do get help, and I hope that they realize that there is so much more to life, and you can be happy, and there's going to be days where you're going to be sad, but it gets better. I'm not perfect. There's days where I'm sad, but it does get better, and I appreciate your time to speak to me, and I appreciate you for speaking to Canadians today who are struggling and for making mental health an importance to you and to our country, because it is important, and people's lives matter, and their mental health matters, and I really do hope that nobody feels alone today.
Well, thank you for saying that, but mostly thank you for sharing your story with such strength, and thank you for creating this platform where, you know, I can talk directly to so many people. This is the kind of conversations that people should be having every evening around the dinner table with their friends when they're feeling low, and we should all be a lot more comfortable talking about the things that are difficult, because they're the things that really matter.
Yes, I agree with you. This is
Thank you,
amazing.
Brittany.
Thank you.